This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222. On the male side, I've already mentioned the indication for IVF is low sperm numbers. That's the main issue. There is a small group of men who have erectile dysfunction, so they can't have intercourse or they can't ejaculate. And obviously IVF gets around that problem, provided they can also produce a sample with masturbation. The indications for IVF are multiple, but in the bottom line is make sure before you go down the IVF route that every other opportunity has been looked at and management of those things has taken place before you move into an IVF cycle. So when you are looking for expert opinion in relation to your difficulty conceiving, find experts. And there's one group called the Certified Reproductive Endocrinology and Infertility Specialists who've done extra training in our college program. There's about 90 of those around Australia. It's worth finding one of them because they have much more detailed knowledge than a generalist who just dabbles in IVF along with their obstetric practice and their gynae practice. So not everybody needs IVF. Make sure that every opportunity not to have IVF happens because it's expensive and in fact quite traumatic in terms of the emotional roller coaster that comes with IVF, because IVF doesn't guarantee you a baby in the first cycle. The best it can do for women under 38 is around about a 35 to 40% chance of a baby. That's not great. The first cycle can produce multiple embryos, and if you are lucky and get those multiple embryos, that pregnancy rate overall after transferring one and then the next month 2, next month 3, next month 4, by 4 transfers, and if you're under 38, you've got an over 80% chance of being pregnant. So IVF is a good treatment, but it needs to be used appropriately.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.